Next speaker before lunch, Dr. KaKit Hui, is the Wallace Annenberg Professor in Integrated East-West Medicine, founder and director of the Center for East-West Medicine in the Department of Medicine at UCLA. He's really recognized as an authority in Chinese medicine and integrated medicine, has served as an advisor to the World Health Organization, and will be speaking on integrative East-West medicine to optimize health and wellness.
Good morning. Would you all stand up because you've been sitting for too long, and I kind of want you to kind of stretch a little bit, okay? So what I'm trying to do today in 25 minutes is to share with you kind of some of my advice for my students, my patients, and hopefully it will be helpful for all of you. And I would say a few words about what I would suggest to you when you are concerned about pancreatic cancer, you're a pancreatic cancer survivor, or you're a caregiver. So that was me. I've been at UCLA. This is my 54th year at UCLA. And been with the UCLA health system for, kind of one and a half century. And so I spent the first 20-some years to kind of figure out what are some of the strengths of conventional biomedicine and also what we can learn from Chinese medicine that's been around for 2,000-3,000 years. And in December 1993, so this is our 30th year anniversary, to try to figure out how we can build a better healthcare delivery system with the model. So today I can just share with you sort of what we do clinically and also what we are trying to do with education to help different people to appreciate what we can do for ourselves to maintain our health and also our family and our community as well. So we have been running our clinics, but again, we have such a heavy volume, so we really want to spend more time to make our work available to more people through our educational programs, and we are now taking our work also to the underserved population. So most of all these doctors, actually all the doctors have been trained through our UCLA programs, through medical school, residency, rotation, and also fellowship. And we have a clinic in Santa Monica. We have a Torrance clinic. We also have a clinic in Westlake. We also have a program within UCLA in Westwood for people who go in and out of hospitals. We also have an inpatient program in Santa Monica as well. And most of our patients, come to us unfortunately, as a last resort. And what we are trying to do is to train more primary care physicians to incorporate some of these approaches within, their clinics. So this is a clinical model that kind of try to understand the person, because if you don't understand the person, their kind of mental health, their stressors, their sort of their life history, and also how, they have, their life style, as well as their sleep, their exercise routine, as well as their sort of way of handling their stress. And what we try to do is to provide some assessment of what we can do for them and what they can do for themselves and what the family can do for themselves, so that we work as a team. And oftentimes we have kind of more or less be just able to kind of orchestrate, the care. We work with all the, UCLA, top surgeons and physicians, oncologists, and so on. But it's not just a patient with cancer, but we see people who refer to us by, more than 500 physicians within UCLA. And what we provide is, within the clinic, is acupuncture or acupuncture-like stimulation, because we really do not have enough time for the patients. We teach them what they can do for themselves at home. And there's not enough time for me to try to explain why it's so important for people to understand your stress. It's not just psychosocial stress, it's mechanical stress. The wrong exercise can also contribute to ill health as well. And in a sense, when the weather changes, the cold weather has affected so many people who have their pain coming on. And so pain is what most people think about referring to us, but we see people who basically come in with so many different diseases. But by virtue of using this model, I won't have time to kind of go over all the things that we do, is to teach people what may lead to where they are. When we oftentimes look at their life cycle, kind of see that their body is already declining, and it's very important for people who are under so much stress, when you're caring for your loved ones, that it's important for you to find time to take care of yourself. And some of the things that we recommend, basically, we want to make it available for many young people as early as possible. So, in a sense, our success is due to really having the patient to understand what they can do for themselves, teach them what to avoid, what to do, how to eat right, and then try to have them change their lifestyle. Exercise is important, but if it's the wrong exercise, it can aggravate the problem. Sleep is very important, and having the sound sleep, so that's what we also try to emphasize. And then with nutrition, obviously, we've achieved nutrition here, Dr. Xiaoping Li. We incorporate also the Chinese medicine approach of nutrition to customize for the patient. I think there's an overlap between East and West in terms of having an anti-inflammatory diet, because I think 70–80% of chronic conditions, including cancer, has that inflammatory component. So every time you really try to, figure out is that what leads to the inflammation, and you can actually do a lot of things to minimize that. So regardless what the diagnosis is, it's important for you to embrace this whole systems of care model. So by 1999, after I established the center for a few years, I already, make my recommendation to the WHO to try to have them, recognize the potential of Chinese, medicine. And about 2006, I put my ideas after caring for quite a number of patients with cancer that the potential for this person-centered model would be very, very helpful. And I think that many of you, the reason why I want you all to stretch is because I know that many of you have knots in your neck and also in your back as well. And those are not just like orthopedic problems. These represents a problem of flow and also balance, and then if it continues to give you symptoms, to warn you, but if you just use ways to just suppress it without really recognizing the root of it. So I kind of, I'm not an oncologist. I take care of patients with cancer along with other, many other conditions. But I kind of see that, by the time one have a solid, type of mass as a cancer, the process is very, very advanced. And I kind of see that when we have any sort of knots in the neck and back, it may contribute to some of the symptoms that, you go have evaluation and people may not, be able to find what it may be, causing it. So to me, anything that would, get our system in our balance and there's a spasm, it needs to be, relieved. And obviously, stretching is good. Having, sort of massage is good. I enjoy massages. It's my way of handling the stress that we get as a clinician, as a physician, but I think all of us are stressed. So I think the most important thing is to figure out how do you minimize the stressors. On the other hand, try to build up your own resilience. And that meaning that having the good sleep, eating right, exercise appropriately. And I, obviously see a lot of patients with breast cancer. I also spoke at ASCO for lung cancer. But I think that it's really important that all of you who are concerned, either you're a survivor or you have family history or you have the cyst, you're at risk. Some of these approaches I would recommend you to at least explore and see what you can do for yourself. And obviously, integrative medicine has been around for a long time. China embarked on this integration of Chinese and Western medicine since 1955. In our country, in 1992, the NIH just provided $2 million to start the Office of Alternative Medicine. Right now, there's a National Center for Complementary and Integrative Health. So now with integrative medicine applied to a patient with cancer, so there's a field called integrative oncology, and there is some guidelines just for pain management. But I think a lot of the approaches may be helpful, not just for pain. So as I keep emphasizing that we need to look at the person, and most of the evidence that's increasing, that's not enough, and that's why we can have to worry about some of the so-called unconventional approaches that may be dangerous, and hopefully by someone who dual trained may be able to help people to navigate, and that it's sort of important for people to be empowered to sort of take care of themselves, and there's been a critique of the current model, by a lot of people, including now the NCCIH director, but also like the Harvard Medical School Chamber of Medicine. They're talking about the concern of kind of the person is being cared for by different experts for different aspects of the disease or their organs. So the movement right now is to kind of take this back to looking at the whole person, and that so a lot of the sort of risk factors for many different diseases, whether you're worried about Alzheimer's, you're worrying about sort of many of autoimmune diseases and cardiovascular diseases and so on. The pathophysical processes are very similar. So it's very important to try to understand how best to kind of use this approach. But most important is to prevention. Prevention for any bad disease to occur, but that's why, even though after, surgery, Whipple was what turned me off from surgery. I was, working with Ed Pizarro. He was the one at the VA when I was working with him. And 7-8 hours is such a big, long surgery. But anyway, it's important to try to apply sort of these approaches, throughout the journey. And that's the reason why for many years I kind of look at palliative care. Palliative care, I know there's a talk later on, that no longer should be hospice, because you should not just think about using drugs to suppress symptoms. The model that we have created is to help the body, become strong enough to be able to make the symptoms not appear. So that's a big difference. So by virtue of having the person not having pain, not suppressing the pain signal, which tells you you are able to actually have many of the symptoms like dizziness or other sort of diseases. So a lot of our patients, once they take care of themselves and we teach them their blood pressure, their blood sugar, their immune dysregulation also would get better as well. So it's sort of important for us to not just deal with the physical part, but also the emotional, but really the spiritual aspect of it. And I think that this morning, Dr. Tran may already have talked about some of the mind-body modalities, and I think the appropriate exercise, and I think acupressure type massage and acupuncture-like stimulation, if you worry about needles. We teach people how to use tennis ball, golf ball. We teach them how to buy a TENS unit. And then with the diet, we in general have an anti-inflammatory diet, but also we look at the patient's pattern or their constitution, and we make the adjustment according to, change of, for women, the period, and also during the sort of different stages as well as the seasons changes. So these are some of the healing techniques administered by healthcare professionals, and so it will be important for you to use that as a way to calm yourself so that you are able to bring your body back into balance at the body, mind, spirit level, so that the inflammation would not be continue to hurt us. Inflammation is actually good. It says that when the signal is not being shut off, pain is good, but unless you shut it off when it's not needed. So acupuncture is really, to me, not necessary to require a needle, and that it's a way to rebalancing the system, and that the body will tell you, because many of you who are those knots, those are acupuncture points. And in Western medicine, many of them overlap with the trigger points. So that's why we also teach the patient sort of that they can manage the trigger points. So your physical therapist would actually also talk to you about your trigger points when you go get treatment. So the WHO actually has been much more lenient because of the global population. In this country, we are a little bit more, in the US, we are just more sort of hard-nosed about, well, get me the evidence for. So over the last, I would say, 40, 50 years, President Nixon went to China 1972. So there's been increasing amount of data to demonstrate the value of acupuncture for us. Acupuncture is very useful for pain. Acupuncture is very useful for stress by virtue of able to do that. And by virtue of actually acupuncture re-regulating the vagal and the sympathetic system. Sympathetic is driving our heart to beat fast. At the same time, it also would increase inflammation. The vagal tone, by doing deep breathing, by doing a lot of the ways to activate the vagal system, you'll be able to not just slow the heart rate down, but also to decrease inflammation. Because the vagal nerve actually modulate the inflammatory cascade in the body. It's published in Nature 25 years ago. So what can we do using acupuncture? So we actually have a conference to talk about chronic pain and how we can help people with it. Part of it is the post-op cancer pain. We see some of those patients, post-op nausea and vomiting. And sometimes we actually have patients before the surgery come to us before they actually get their surgery. Hopefully, it would minimize the symptoms, but also make them heal them faster. We see a lot of gastroparesis in our clinic. It's not necessarily post-surgical. Then the complications from the medications. And I just saw one of patients who's a survivor with neuropathy from the chemotherapy. So we actually wrote about the potential for acupuncture for chemo-related cognitive dysfunction. We actually are helping patients with long COVID, who have brain fog, or people with fibromyalgia who have brain fog as well. So besides the needle, these are things that one can do to massage, the various acupuncture points. And I have a massage chair that I do it every day to get rid of the knots in my back, because those are the autonomic ganglions, okay? And I think one thing I want to sort of talk about is, and I talk about this, throughout many cities, particularly in China, because, in the US, we are very lucky that many procedures, many expensive procedures are covered by Medicare. But in many countries, it's not covered. But I know that the copay is actually the financial toxicity is affecting many families, and particularly in many countries, the expensive drug would basically, bankrupt. So I think what I propose is that if someone has a very serious illness, particularly if they are elderly, already have a very poor quality of life, it's very important to try to have an assessment, particularly with geriatrics, because I was sort of at ASCO 2018, I kind of look at geriatric oncology has been around for 20 years. I think it's very important for us to assess what will be your quality of life if you go on with an intervention, and that's why you have to, for the quality of life, you have to include financial toxicity, okay? So the ideal case is to have something that will, improve the quality of life and also the quantity of life. Another possibility, would be, decrease the quality of life and also decrease the quantity of life. So I think it's important to try to look at some of these factors, as you navigate. And it's tough when someone get the diagnosis of cancer, and I think that a lot of, at least, in China, it's like, do you want to mortgage your house? Do you want to have the funds for your kids or grandkids? So this is something that I have want people to have a good assessment before you embark on making very drastic decisions. So a few words about pancreatic cancer. I think it's very important to, once you have that diagnosis, but realistically, even before you are concerned about pancreatic cancer or you're concerned about any serious illness, it's important for you to embark on some of the things that I talked about earlier in terms of dealing with your stressor, eating right, having good sleep, doing the right kind of exercise, and I think that it's important to try to not wait until you have the firm diagnosis. So that's why you push your, don't worry about, like, that's why if you're already a cancer survivor, you should embark on some of these, using these approaches. If you have a cyst, while you monitor it carefully on a monthly basis, but you should be doing a lot of the, ways to improve, your chance of having any illness. So these are sort of some of the unmet needs that was shared with me by one of the oncologists who's very interested in lifestyle medicine, who put this together, for this talk. And so it's kind of important that the team need to work together with you being the sort of the one in the center, the family. And I hope that kind of important for not just the patient, but the caregiver, and hopefully someone within the family who will be able to help, the patient and the caregiver during this, this journey. So in general, I kind of see that East-West medicine can really be very helpful in many aspects of the journey, and that the most important is to really appreciate, sort of the philosophy of life. And I think with that, I was reading, this paper about PTSD. It's not just for the patient, but for the caregiver as well. And that it's very important that you all take care of yourself, have some self-compassion. And because we see a lot of women in our clinic as well, and I think that because many of them are the caregivers, and that unless they have some time to take care of themselves, so I kind of see that unless we kind of take care of the whole family as a unit, and I'm so glad that Agi is putting this together and have all this educational material, for you, and I kind of wrote this paper. I was going to publish it in this country, but then China is just very behind with the hospice sort of a movement, and the kids are in a bind because they don't want to be murdering their parents, and but I think that you don't have to. That's why I try to say if you employ this model, you will be able to hopefully minimize the person's symptoms by improving the body's, ability to handle the stressors. You minimize the stressors. You make them sleep better, eat right. So that's why a lot of these optimization of the whole family, the whole person, would be very, very important. So that's what I summarize some of the things that we have written before. And we are, teaching for our medical students, we've been teaching it for 27 years. For our undergraduate at UCLA, we've been teaching it for 14, 15 years now. And so that's what we try to do with our education, team online. So we want to do partly online and partly in person. For the last 3 years of the pandemic, we've been doing it online. So if you can sort of go and sort of get our QR code, some of our material will also be like the acupressure, that we teach all our patients will be there. So I only have 15 seconds. I just want you to kind of, most of you are probably senior enough that you may not be pregnant, so I want you to learn how to just massage your second metacarpal, because when you are under a lot of stress, this muscle on your second finger will be sensitive, will be lumpy, will be tight. So if there's only one area that you want to massage for yourself and you said you have no time, you just learn how to massage this point, okay? So I think that's probably my last slide. Yes. Thank you very much.
Hi, I have a question, and I guess it can apply to anybody, whether you have cancer or other health issues. Our daughter has a very, very rare autoinflammatory illness that causes bone lesions, and along with her Western medicine, it was a very difficult path, but she did end up having acupuncture, which controlled her pain tremendously. It was amazing. But there were also herbs that her acupuncturist wanted her to take, etc. What I'm concerned is when you're taking traditional medication and then you're prescribed herbs, the interaction between the two, and that's number one. And number two, are you finding, when we brought up insurance before, are most bigger insurance plans now embracing Eastern medicine?
Well, this is a very good question, and one of the reasons why in our clinic we do not routinely prescribe herbal medicine the conventional way, where herbs are used as sample and people take a herbal supplement. I mean, I did not cover this, but obviously in China they have guidelines to use herbal medicine for different type of cancer. So it's sort of our concern too, because I'm trained as a clinical pharmacologist and internist, so you always worry about herb-drug interactions. Drug-drug interaction is tough enough. Drug-nutrition interaction is tough. So usually I would suggest people do not use herbs, particularly herbs that may improve blood flow, and for sure you don't want to do it before surgery or after surgery. And at the same time, with radiation and chemo, some of the herbs may affect, those effects. But in terms of like trying to, before, weeks before surgery, if you want to use herbs, and most of the herbs, we use it in the form of diet, okay? So that's like 15% of the herbs are in your kitchen. So you can, use that. So in terms of insurance, I think that Medicare, because of opiate crisis from the narcotics, that President Trump have executive order to allow acupuncture to be used for low back pain. But many other insurance are beginning to cover acupuncture as well. And I think even Medi-Cal are now beginning to pay a little better for acupuncturists to do it, just before they pay so little that the bill is higher than what you collect. So, but I think that motion picture, they pay for acupuncture. So in a sense, in our clinic, obviously, all of us are board certified internists, except for a couple of family medicine. So we could have we bill for the office visit, and also most of the patients also have trigger points because of their pain. So the trigger point is also a Western technique. So acupuncture, some people have to pay out of pocket, and they come to us because it's the cheapest, compared to acupuncturists in the community. Okay, I'm, obviously the last session before lunch. I think it's probably lunchtime right now. Thank you so much.